works and how the patient would benefit out of it. We have with us Dr. M Karthigesan, who is an interventional cardiologist and an electrophysiologist at Apollo Hospital, Chennai, who will be taking us through this new technology. We also have with us Dr. Venkatachalam, Director of Medical Services at Apollo Hospital, Chennai. So to begin things, I would like to invite Dr. Venkatachalam to give the inaugural address. Doctor, over to you, please.
And electrophysiologist of Apollo Hospital, and this is very important technology which Dr. Karthigesan will take us through the presentation. At Apollo Hospital, we always wanted the best care to be given to the patients. When our chairman started our hospital, Dr. Pratap Sireddy started our hospital in 1983, the first hospital in Chennai. We started this one to bring the international standard of care to reach out every individual of our country. In that journey, and we ensure that in each and every field, we give that international standard of care, the best care what we can give, or any patient getting anywhere in the world is access to that care in our country. Apollo Main Hospital is one of the leading healthcare provider in our country. Is ranked number one hospital by various magazines, various organizations does hospital assessment, and we always lead the healthcare in this part of the world, not just for India but across South Asia. And especially the cardiology department, we have many subdivisions, and one of those is rhythm disorder, where the electrophysiologist correct any rhythm abnormalities. To correct that, many hospitals across our country, in anywhere, the pacemaker is being done now. And when that get infected or for some reason have to be removed, and it is a difficult and very, we have to give complete safety to the patient while removing, because these pacemakers are there for many years, 10 years, 15 years, 8 years. So while removing, we should remove it without any complications. Earlier, removal through surgical means makes the patient to stay in the hospital for longer time, and that itself should not become a impacted process. So therefore, the standard of care always to ensure that the patient safety is very important. But with the arrival of this technology, laser technology, the removal becomes much easier and safer to the patient without much complication. Now, Dr. Karthigesan has first time in India performed this procedure using laser technology to remove the pacemaker and pacemaker wire, and this is something is going to be very helpful for those patients whose pacemaker needs to be removed. And this technology will be available now. Now we started in Chennai. This is Center of Excellence for Cardiac Disease, and we will extend this for all the Apollo Hospital. But now this patient we have, sir, thank you, Mr. Gopal Chaudhary, the patient. He has come from Jharkhand, and the trust with which they come here, that we do the best for them, and we always ensure that we give that best. And I thank Dr. Karthigesan for having done this procedure successfully. In the procedure, ரொம்ப முக்கியமான procedure, the cardiac pacemaker removal. இன்ஃபெக்ட் ஆன பிறகு இல்லாட்டி ஏதோ அது மால் ஃபங்க்ஷன் ஆனால் நம்ம அந்த கேத்தேட்டரை வெளியில் எடுக்கிற போது ஒரு சேஃப்டி, பேஷண்டோட சேஃப்டி ரொம்ப முக்கியம். அதில் சர்ஜிக்கல் வழியாக தான் முன்னெல்லாம் எடுப்பாங்க, இன்சிஷன் பண்ணி கட் பண்ணி. அப்படி எடுக்கிற போது அதில் உள்ள ஊண்டு, அது ஹீலிங், ஹாஸ்பிட்டல் ஸ்டே பண்ணுற ஸ்டேலாம் ரொம்ப அதிகமான நாளாக இருக்கிற மாதிரி இருக்கும். இப்போது இமீடியட்டாக பண்ணி இந்த பேஷண்ட் வீட்டுக்கு டிஸ்சார்ஜ் ஆகிடலாம். அவங்களோட காஸ்ட் கூட ரொம்ப கம்மியாகிடும். அண்ட் பேஷண்ட் ஃப்ரம் டிஸ்டன்ஸ், வெளியிலேருந்து வர்றவங்க இங்கே ரொம்ப நாள் ஸ்டே பண்ண தேவையில்லை. இந்த டெக்னாலஜி இப்போ இந்தியாவில் முதல் தடவையாக நம்ம அப்போலோ ஹாஸ்பிட்டல் இன்ட்ரடியூஸ் பண்ணியிருக்கோம். டாக்டர் கார்த்திகேசன், நம்மளோட கார்டியாலஜிஸ்ட் எலக்ட்ரோபிசியாலஜிஸ்ட் இந்த ப்ரொசீஜர் பண்ணியிருக்காரு. எங்களோட ரிக்வெஸ்ட் ப்ரெஸ் நண்பர்கள்கிட்ட இந்த நியூஸ் வந்து எல்லாருக்கும் போயிட்டு சேரணும். ஏன்னா இப்போ லாஸ்ட் 10-15 இயர்ஸ் இந்த பேஸ்மேக்கர் பண்ணியிருக்கிறதுனால 20 இயர்ஸ்க்கு அந்த பேஸ்மேக்கர் நிறையவே பண்ணிட்டு வராங்க. இப்போ லாஸ்ட் ஃபியூ இயர்ஸாக நிறைய நடந்துட்டு இருக்கு. இதை ஈஸியாக ஏதோ ஒரு காரணத்துக்காக ரிமூவ் பண்ணணுன்ற போது இது ஈஸி டெக்னாலஜி அவைலபிள் வித் வெரி வெரி மினிமம் வித்தவுட் ஆல்மோஸ்ட் ஜீரோ காம்ப்ளிகேஷன்ஸ். திஸ் கேன் பி டன் சேஃப்லி. இந்த மெசேஜ் வந்து நீங்கள் எடுத்துகிட்டு போகணும். அப்போலோ ஹாஸ்பிட்டலில் நம்மளோட நாட்டில் முதல் தரமான மருத்துவமனைனால இது எங்களோட சேர்மன் இந்த ஹாஸ்பிட்டல் ஸ்டார்ட் பண்ண காலத்துலேருந்து ஏதாவது நியூ டெக்னாலஜி எங்கே உலகத்தில் இருந்தாலும் அது முதல்ல வந்து இந்தியாவுக்கு வரணும், அதுவும் ஸ்பெஷலி சென்னையில் இன்ட்ரடியூஸ் பண்ணணும் அப்படிங்கிறதுல அவர் ரொம்ப ஆர்வமாக இருப்பார். அந்த வகையில் நம்ம வந்து எல்லா நியூ டெக்னாலஜியும் நம்ம அப்போலோ ஹாஸ்பிட்டல் சென்னையில் வந்து வச்சுருக்கோம். இது ஒன் மோர் டெக்னாலஜி. ஸோ எங்களோட ரெக்வெஸ்ட் இந்த மெசேஜ் வந்து நீங்கள் மக்களுக்கு கொண்டு போயிட்டு சேர்க்கணும். இந்த ப்ரெஸ் கான்ஃபரன்ஸ் வந்து உங்கள் எல்லாருக்கும் நன்றி சொல்லிக்கிறேன். I now invite Dr. Karthigesan for.
Okay. So what we have done is a first laser assisted pacemaker removal. So before going to what is pacemaker removal, so let me introduce briefly what is the pacemaker and so why it is implanted and so what is the process so that you can understand better what is it, why it is very, very important. So cardiac implantable electronic devices, which is broadly classified as a cardiac implantable electronic device, which includes pacemakers and defibrillators and resynchronization therapy. So a lot of electronic devices we implant inside the patient's heart to improve the cardiac condition. So at different indications. For example, the pacemakers are like this, the small battery operated devices. This is implanted here in the shoulder region below the collarbone. The wires which are going inside the heart. Wire is a link between the machine to the heart. So the wire goes inside the heart and the machine lies below the collarbone. So through that machine continuously analyzes the heart rhythm, how the heart is beating. Whenever heartbeat is slow, it doesn't allow the heartbeat to go very slow. It will maintain the heart rate at whatever the set rate is, 60 or whatever it is. So the other device called defibrillator. So this is the device which I was explaining, the pacemaker. The wire goes through the venous channel and get into the heart, these wires. And the other thing is a defibrillator. Defibrillator, many of you may not have heard of it. We often heard from the media channels, you called about a person suddenly died, person suddenly sleeping died, a person driving the vehicle suddenly collapsed and died. What do you call sudden cardiac arrest? To prevent that, some high-risk patients, we implant some electronic device which is called defibrillator. So once you implant the device, it is like a pacemaker, but what it does is, pacemaker only maintains the low heart rate. It doesn't, when the heart rate goes very fast, it doesn't do anything. But the defibrillator, whenever heartbeat goes very fast, life-threatening manner, it gives a shock, it makes it normal. So it is a defibrillator. So that also implanted the shoulder region, the wire goes inside the cardiac tissue and get implanted inside the heart. That's what you can see, that pacemaker, which is, whenever the heartbeat is low, the heart is beating. You can see that generator is, battery is located at the shoulder region, the wires which are going inside the heart and connected to both upper and lower chamber of the heart. Same thing, you can see the defibrillator connected to the heart, and you can see now, suddenly heart started beating very fast now, which is within few minutes, patient can die. Then it recognizes it within few seconds, and then give a shock and make the heartbeat normal. So it is a defibrillator. These are the devices, these are all comes under a group of cardiac implantable devices. Like sometimes we put 3 wires, instead of 2 wires, we put 3 wires. Heart has 4 chambers. Out of 4 chambers, we implant wires in the 3 chambers. When we implant 3 chambers, it boosts the pumping function of the heart also. So all those devices that we implant as electrophysiologist, rhythm specialist, we implant these electronic devices in the shoulder region. Under local anesthesia, we implant these devices. It's commonly done. You can see some patients have multiple wires. You can see 3 or 4 wires are there inside the heart. The machine is in the shoulder region. So all those wires stimulate the heart. It gives electrical signal, stimulate the heart to boost the pumping function of the heart, to maintain the adequate heart rate. So it will prevent them from suddenly dying. All those things it does. So what is this implant devices and scenario in India? Approximately per year in India, 60,000 pacemakers are being implanted in India across the country. Dr. Vangarajalam said, even smaller setup, smaller hospital implant pacemakers, because it's a life-saving procedure. If somebody's heart rate stops or goes very low, we need artificial devices like this to maintain their heart rate. These implantable shocking devices, ICDs, approximately 10,000 devices per annum, it has been implanted across the country. Other device, heart failure device, CRT devices, 15,000 per year, it has been implanted. So on an average, if you see, so 250 implantable devices every day, it is happening in India. So 250 devices across India, some or other centers are keep implanting any of the devices, electronic devices. When you are implanting devices, infection happen anytime in the body. Okay, so these infection rates are the infection can happen in the site where we implanting from the common cells which is located in the skin can get into the bucket or anywhere in the body patient is getting infection can travel through the bloodstream and go and sit in the pacemaker area can infect the pacemaker. So the infection chances are there whenever you put a foreign body. The pacemaker is a foreign body. So when it goes inside the heart, sometimes the infection go and infect that area, cause infection, fever, and so on. This ICD was a little higher side. The devices become bigger and bigger. Pacemakers are very, very small size. ICD and other shocking devices are all bigger in size. When the device is bigger and bigger, the infection chances are more. And all the more, Dr. Venkateswaran mentioned it, these pacemakers are going to be there in the patient's body for longer period of time. The battery usually 10 years. After 10 years, the battery has to be replaced, then one more battery will be implanted. So that goes on for another 10 years. So when you are living with that pacemaker, when you are replacing it, the chance of infection getting more higher and higher. So that is where the problem comes. So who are all high risk? Those patients on steroids, those who are on dialysis, those who are immunosuppressant agents. In fact, their immunity is very low. They are all very prone to develop infection. Diabetic patients, those are all highly developed infections. Usually the infection happens within 3 months. 60% people get infected, some or other reasons, which I mentioned it. Some patients, 40% of patients develop. Yeah. So 40% of the time, it happens after 1 year. So this is the reason. So why is this after a late infection? We call late infections. Majority of the time, the moment you implant it, so after a few weeks, a few months later, you will come to know that wound is not healing, some pus discharge is coming out, or the wound is giving away. All those you will find out. Some patients it heals nicely in like our patient. Then after 6 months or 1 year, then there will be a discharge started coming or will be coming out. So the late infections are possible. The challenges are how do you, once it's infected, again is the basic dictum of medicine is any foreign body is there which is getting infected, the foreign body should be out. If you cannot manage that infection, then keeping the foreign body inside the heart. Okay, so that is what the problem happens. How do you remove it? You have put the pacemaker, so already the patient has lived for 5, 6 years or 8 years or 10 years or 15 years. Now some infection has happened, then you have to remove the pacemaker. So that's where the challenges happens. Why it is getting, how do you remove it? Well, implantation is, as I mentioned, per day 250 implants are happening across India. Even smaller setups are able to do simple pacemakers, one wire pacemakers, because it's a life-saving procedure. But when the question comes to remove it, then there is a problem. Hardly you can count the centers in India which can capable of removing it. The reason being is, because once the pacemaker is in, the wires are going inside the heart, the tissues will grow over the wires, it get nicely fixed, so that you cannot able to remove it at all. This removal become very, very challenging, because it is adherent to the heart and all the blood vessels. When you try to remove it, it can tear the heart, patient can die on table. Okay, so this is one of the highest risk cardiac intervention performed. Okay, because of that, even though many centers are implanting pacemaker, when the question comes to manage the infection and removing the pacemaker, hardly any centers is able to take that risk, have the capability of managing the patient, as repeatedly Dr. Venkateswaran mentioned, safety of the patient. It is very, very important to maintain the safety. Same time, you have to remove it also so that infection. If you don't treat it, the infection can spread in the body and get into the bloodstream and goes everywhere in the body. Patient will become problematic. So this is what it happens. The patient becomes swollen pocket, swelling, discharge, all those things happens. You can see that small bulge happens, then slowly the pacemaker slightly coming out. You can see slightly pacemaker started coming out. After 2 days, you can form some discharges coming from the wound, from the operated site. Sometimes it comes out also. So you can see the pacemaker is totally out. You can see the pacemaker is lying outside. So when the infection spreads in, it comes out. So how do you do it? That's what, you have to remove the battery. That is, many centers do it, they remove the battery. But the problem comes, how do you remove the wires which are there inside, which is nicely fixed for many years, 10 years, 20 years, it gets fixed. How do you remove it? So you, of course, you have to give antibiotics, but these antibiotics doesn't work unless the foreign body is removed. So you have to be very careful, so if you remove it, then give antibiotics. That's what, so the wires which are going inside get nicely fixed. And then you can see here, this patient, the wire, the pacemaker was removed, the wire was not removed. Because the operating cardiac felt is removing is very challenging, he just cut the wire and left it. You can see this patient also, the wire has been cut and it is left. So why they are not able to remove it? Why they are not thinking of removing it? Because this is a reason. It is occluded. You can see the blood is going and stops here. There is no more blood flow there. It is because totally tissues are grown over that and block the channel. So you can't pull it out at all. So because it's nicely adherent to the vessel wall, any sort of pulling can, becomes life-threatening to the patient. So, but if you keep the wire like this and then keep giving antibiotics, the wound doesn't heal, the infection spreads all over the body. That's not the problem. Our patients like this was managed for 6 months. We come across many patients like this. Then the pacemaker generator is removed, but the lead has not been removed and it has cut and left it. They continue to pour pus and then they come to us after many months of taking antibiotics. So because of this complete closure, this removal become possible. The reason is because the tissues are grown over it. You can see how much the tissues has grown over the wires. So you cannot remove it just by pulling or any other method. So that is the reason many centers implant it, they don't remove it. When it comes to the infection, they take the hands off. This will not be possible. So some centers, they just cut it and left it and then the wound doesn't heal, the patient condition deteriorates. We have now new technology. So previously when this sort of patient comes, many times we have to go for open heart surgery or some tools, mechanical tools, we use it to remove the wires. So now we have come across laser technology. Technology was launched in India 2 years back in 2021. And 2022 last year, the end of December, so the new laser technology has been launched in India. And then, so this year onwards, we have the facility to remove the wires. So the laser basically introduced in India for many reasons. One is even the coronary blockages, you have heard of it, for laser angioplasty. So we can do angioplasty with the laser. Blockage of the blood vessels can be opened with the laser also. So any of the peripheral blood vessels, the blood flow to the legs or anything blocked, it can be opened with the laser. Like that, the same laser technology can be used for this condition also to remove the wires. So which is adherent to the vessel wall. How do you do it? We have the sheath that will pass over the wire, the sheath will pass, the tip of the sheath will emit the laser. When you emit the laser, it resolves. You can see this video. I hope it runs. Yeah, you can see the laser is passing through that. The tissues is getting cut and the laser is passed through that, the wire, it's over the wire, it goes through that. Whatever the tissues are grown over the wire, when the laser emits the laser, it dissolves it, it disintegrates it, it frees that wire from the adjacent tissue. So once it goes, then again it goes. Whenever there's no adhesion, it goes freely. Whenever the tissue has grown over it, it goes slowly and then it removes it. This is how it does it. And then this is very, very important technology for us to use it to release the wire and take it out completely. When the infected wire comes out totally outside the body, the wound heals very quickly. Okay, then within one week we are done. Now that today I removed the sutures and everything. So it is quickly wound heals, which is not healing for more than 6 months. Now within a week the wound has healed once the foreign body is out. So how to remove the foreign body, this is what the technology to remove it safely. This is what you can see the multiple wires are there inside the heart. You can see the wires and then you can see that so many type of wires are available. So you can see the multiple types of wire leads are available inside the heart, which goes from the pacemaker to the body. And then all this, you can see that this patient having multiple wires, 1, 2, 3, 4 wires are there. So removing it is become very challenging unless you have the sophisticated technology to remove it safely from the patient's point of view. So this is what the recent laser, even though laser is the old one, the latest technology launched, as I mentioned last year, December, which is a new one, which is a titration capacity is there. We can titrate it how much laser to be emitted from the tip of the catheter. Okay, so that we can dangerous area, we can emit little less, and a free area, we can emit more. So whereas the adhesion is more, we can emit little more, whereas adhesion is less, we can limit less. So the adjustable capability is there with this laser technology, and it has a fully controllable manner, is easy to operate, and it is, so quickly the patient, without less morbidity, wire can be removed. As I mentioned, otherwise patient has to go for open heart surgery, open the chest, remove everything. It takes 10 days in the hospital, then another 10 days for antibiotics. Wound healing takes a lot of time. Now, in a matter of half an hour, the wire can be removed safely and without any much problem. You can see this is what we. It's not running. Okay. So the tip of the laser is emits the ultraviolet light. And the ultraviolet light emits only 50 microns distance. When the ultraviolet light is emitted to the tip of the catheter, it dissolves the tissues around it. When it dissolves, so it keep moving with the dissolved manner until reach the end of the tip, and then it get entirely free from the adhesions. Just take it out. So this the dissolving the adhesions. This laser helps us to dissolve the adhesions. So that's what we do. You can see this video. I think audio is there. So you can see when you are applying the laser, it is the wires keep going. That So this patient has the 4 wires. Left side 2 are functioning. Because the right side got infected, they removed it partially and put the new one on the left side. The left side is patient is doesn't have his own heartbeat. He is living on with the functioning pacemaker on the left side. So without damaging the functioning pacemaker, we have to remove the right side pacemaker which has got infected. So that's why the challenge. That is one of the advantages of using laser. Laser doesn't damage the functioning pacemaker. So, so when you put in the laser, wherever the wire is there, it only remove that particular wire. It doesn't damage the adjacent wire. So that's what we choose this technology, so that the functioning pacemaker, anything happens to the functioning pacemaker, it becomes a life threatening to the patient, because his life is only on the but particular pacemaker which is functioning. So at the same time, we have to remove the infected pacemaker so that the infection will not spread and it will not get into the body. So the wound is not healing for 6 months, so we have to remove it. That's what we do. So slowly we advance this laser and remove it. Once you remove it, you can see that full of tissues grown over that tissues. You can see that full of tissues, how much tissues at the tip of the catheter is getting under. So it is very difficult. If you pull it out, it will tear the heart. So the patient will collapse on table. So there is a very high risk procedure. So we emit the laser, fill up the tip, dissolve the tissues around it, and safely pull it out. And this is what we have done. This patient has, our patient Mr. Gopal Chaudhary, so he has a functioning pacemaker left side. The initial pacemaker was done on the right side, which got infected. 8 years later, it was removed and the left side was implanted. He is living on with the left side pacemaker. But the right side pacemaker partially removed, the wire was left alone because of the reason which I told, because the wound is completely blocked. It's not decided to just cut through